Types of lung volume. Lung volumes. Tidal volume, inspiratory reserve volume, expiratory reserve volume, residual volume. Types of lung capacities. Capacity, contain one or more lung volume. 1. Inspiratory capacity. 2. Vital capacity, forced vital capacity. 3. Functional residual capacity. 4. Total lung capacity. What's tidal volume and its normal value? Amount of air flowing in and out of lungs during normal breathing. 500 milliliters. What's inspiratory reserve volume and its normal value? Amount of air inspired with max force after tidal inspiration. Males 3.3 L. Females 1.8 L. What's expiratory reserve volume and its normal value? Amount of air expired with max force after tidal expiration. Males 1.3 L. Females 0.8 L. What's residual volume and its normal value? Amount of air remaining in lungs at end of forceful maximum expiration. 1.2 L. What's inspiratory capacity? TV plus ERV. What's vital or forced vital capacity? TV plus ERV plus ERV. What's functional residual capacity? ERV plus RV, or 1/2 of FVC. What's amount of air expired with maximum force after forceful maximal inspiration? Forced vital capacity. What's total lung capacity? FVC plus RV. What's amount of air remaining in lungs after a normal expiration? FRC. What volume cannot be measured by spirometer? Residual volume. Methods to measure residual volume. 1. Total body plethysmography. 2. Closed circuit helium method. 3. Open circuit nitrogen washout method. What entity does spirometer measure? Measure volume and flow to plot. Volume, time curve, flow, volume curve. In what condition spirometry not done? After MI, stroke, strenuous exercise, smoking. 'Cause it's physically demanding. Procedure of spirometry. Max inspiration then blast of expiration, continue exhalation for 15 seconds then max inspiration again. What is FEV1 in volume time graph? Its amount of air exhaled in first second. Normal value of FEV1, FVC ratio. Greater than 80%, or 4. What's phase of hyperinflation and phase of air trapping in COPD? Hyperinflation. Due to low recoil pressure, lungs are easier to inflate and so they hyperinflate. Air trapping. Due to dynamic compression of airway, they cannot exhale air out. Value of FVC, FEV1, their ratio, RV, TLC and reversibility in phase of hyperinflation. FVC normal, FEV1 decreased, ratio, decreased, RV, increased, TLC, increase. Reversibility, irreversible. Value of FVC, FEV1, their ratio, RV, TLC and reversibility in phase of air trapping. FVC decreased, FEV1 decreased, ratio, decreased, RV, increased, TLC, normal. Reversibility, irreversible. How can we differentiate asthma and COPD after spirometry, as both have FEV1, FVC ratio below 70%? Do bronchodilator reversibility test salbutamol or ipratropium given and examined after 30 minutes. If ratio still less than 70% then it's COPD irreversible. If FEV1 increased by 200 milliliters or 12% then it's asthma. Value of FVC, FEV1, their ratio, RV, TLC and DLCO in restrictive lung disease. FVC decreased, FEV1 decreased, ratio, normal increased, RV decreased, TLC decreased, DLCO, decreased. All decreased except ratio. Which type of RLD has decreased DLO? Intraparenchymal RHD, cause only diffusion disorder. Which type of RLD has decreased FVC and normal DLCO? Extraparenchymal. Among myasthenia gravis and kyphoscoliosis, which one has normal RV-TLC ratio and which has increased? Kyphoscoliosis normal, myasthenia increased. FEV1, FVC, ratio, DLCO in vascular lung diseases. FEV1 normal, FVC normal, ratio normal, DLCO abnormal. Normal flow volume curve shape. Upper triangular expiratory part, lower semicircular inspiratory part. What all parameters can be assessed with flow volume curve? PEFR, peak expiratory flow rate. FVC, area under curve. RV, only theoretically. TLC, flow volume curve finding in severe obstruction. PEFR, severely reduced with coving. Flow volume curve finding in mild obstruction. PEFR, mildly reduced with coving, dogtail appear. Flow volume curve finding in restriction. PEFR, normal or mildly reduced with no coving. What's flow? Rate of change of volume per unit time. Its slope of volume time curve. Flattering of inspiration in flow volume curve is seen in variable extrathoracic upper airway obstruction, e.g. vocal cord palsy, laryngeal tumor, goiter, obstructive sleep apnea. Flattering of expiration in flow volume curve is seen in variable intrathoracic upper airway obstruction, e.g. foreign body, tracheomalacia. Flattering of inspiration and expiration in flow volume curve is seen in fixed upper airway obstruction, e.g., tracheal stenosis. Flow volume curve in neuromuscular weakness. Reduced to small circular shape. Name of staging for COPD based on post-bronchodilator FEV1. Gold staging. Gold staging for COPD. Stage 1 FEV1 greater than 80%. 2 equals 80-50%. 3 equals 50-30%. 4 equals less than 30%. What's DLCO? AKA, use. Diffusion capacity of CO. TLCO, transfer capacity of CO. Use measures lungs' ability to transfer gases across respiratory membrane. Normal value of DLCO in severe disease. Normal equals 20 to 30 milliliter per minute per millimeter Hg. Or 70-140% of predicted value. In severe equals less than 40%. Component of respiratory membrane. 1. Fluid and surfactant. 2. Alveolar epithelial layer. 3. Epithelial basement membrane. 4. Interstitial space. 5. Capillary basement membrane. 6. Capillary endothelial layer. Surface area and thickness of respiratory membrane. Area equals 70 meters square. Thickness equals 0.2 minus 0.5 micrometers. Is carbon monoxide gas, diffusion limited or perfusion limited? Diffusion limited. Factors affecting DL. 1. Amount of blood going to alveolar capillary bed. 2. Surface area available for diffusion. Factors causing false low DLCO. 1. Part on high flow oxygen. 2. Smoking. DLCO levels in pregnancy. Increase. Conditions with high DLCO. 1. Diffuse alveolar hemorrhage. 2. Polysemia. 3. Supine, exercise. 4. Left to right shunt. 5. Obesity, pregnancy. 6. Mild CHF. Condition with low DLCO. Anemia, pulmonary edema, thick interstitium. DLCO levels in Goodpasture syndrome. Low, diffuse alveolar hemorrhage. DLCO can be used in diagnosis of 1. Bleomycin toxicity. 2. Pulmonary vasculitis. 3. Early ILD. DLCO in asthma. Increased cause of pulmonary hyperemia, preferred perfusion. DLCO in emphysema. Decreased, increased volume, area ratio in alveoli. DLCO in chronic bronchitis. Normal. DLCO in intraparenchymal ILD. Decreased thickened respiratory membrane. DLCO in extraparenchymal ILD. Normal. DLCO in vascular lung disease. Decreased, less blood reaching lung. What's KCO? Its coefficient of diffusion. KCO equals diffusion, lung volume. Value of KCO in intraparenchymal and extraparenchymal RLD. Intraparenchymal, normal. Extraparenchymal, high.